Well, hello everyone on this exciting morning, afternoon or evening, and a very warm welcome to our awards ceremony for the Trinity Challenge on community access to effective antibiotics. I'm absolutely delighted that you've all joined us today. This is, after all, our third Trinity Challenge. It's a 1 million innovation competition, and you've been focusing on one of the most pressing and really rather too often overlooked challenges in global health. Those are the barriers that prevent communities in low and middle income countries from accessing the antibiotics they need to treat severe infections. Antibiotics that not only treat infections effectively, but also, because they work, help us to slow the rising tide of antimicrobial resistance, which we all call AMR. It's almost a year ago now that I stood with global leaders at the second UN General Assembly meeting in New York on AMR. And there, 193 countries agreed to take action on the antibiotic emergency. The resulting political declaration laid out a strong framework. But, as we all know, frameworks are only the beginning. And to get meaningful change, we've got to have action. It requires partnership, and it depends on empowered communities, engaged, informed, ready to put in the effort to make a difference where it matters most in everybody's everyday lives. So I'm really excited today and honoured to present our 8 challenge finalists whose work truly embodies this spirit. They are ABX Guard by PATH in India, Comwatch by J-Paego in Nigeria, PADS by the University of Notre Dame, deploying with partners in Cameroon, Ethiopia, and Kenya, Malawi, and Namibia. FATI, never sure I get all the pronunciations right, but Valorigo in the Democratic Republic of Congo, Pravar by the William J. Clinton Foundation in India, RxBot by the Clinton Health Access Initiative in Nigeria, Sproxil Defender by Sproxil, also in Nigeria, and SureDose by the Ecumenical Pharmaceutical Network working across Cameroon and Kenya. What a wonderful set, all deserving of winning. Congratulations to you all, whether or not you walk away with that prize today. Please know that your solutions are inspiring us, they're giving us hope, and they all have great potential. And that's why the Trinity Challenge exists, to harness the best minds, the sharpest ideas, and the most powerful data and technologies driving affordable solutions that work for those communities, your communities on the ground, for real people. So let me hand over to Louise Goff, my wonderful colleague who leads the Trinity Challenge team to make today's event happen. Over to you, Louise.
Thank you, Sally. So as Sally has already outlined, the response to this challenge has been truly remarkable. We had 171 applications from 51 countries around the world, and we would like to take this opportunity to thank each and every applicant. Their ideas have been creative, rigorous and practical: predictive stock forecasting, mobile verification tools, integrated pharmacy dashboards, surveillance systems, and more. They remind us what's possible when innovation is driven by purpose and grounded in community need. Over the past few months, our independent expert judging panel has rigorously reviewed applications, met with our finalists, and identified today's winners. The judges have been supported at every step by our delivery partner, MIT Solve. As in previous challenges, they have been instrumental in bringing this competition to life, and I'd like to thank them for all of their hard work. In particular, our colleagues Noel Shaskin and Taewi Kars. Thank you very much. I am pleased to announce today we'll be awarding 2 joint grand prizes of £500,000 each, which will enable teams to deliver their impactful solutions over 2 years. I can also share the exciting news that with thanks to a grant from the Novo Nordisk Foundation, we will also be offering a post-award innovation support programme to today's winners. Building on the success of similar initiatives from our previous challenges, this programme will provide mentoring and development opportunities throughout the lifetime of each award. Back to you, Sally.
So I too would like to take a moment to thank those who've helped us reach today's really important milestone. And I want to start with a special thanks to our generous funders, the Institute of Philanthropy, empowered by the Hong Kong Jockey Club Charities Trust and the Wellcome Trust, because your continued belief in the power of innovation to solve global health challenges has made our work possible. And I'm deeply grateful for your support. Our sincere thanks also to the Novo Nordisk Foundation, whose support's really going to help today's winners reach even greater heights. From all around the world, our thanks also go to our independent panel of judges. Your time, insights, enthusiasm have all been invaluable. Thank you for your support and service. To our members and ever supportive steering committee, we continue to appreciate your input and insights. I know you're going to be as inspired as we are by the innovation on display today, and I look forward to working together to strengthen and scale these efforts in the year ahead. To my fellow trustees, thank you for your commitment. And finally, to our Trinity Challenge team, Louise, Hamish, Jenny, Alison and Carissa, and former team members, Mark and Charlie, who were all instrumental in launching the challenge and getting us to where we are. Thank you for your tireless work in guiding this process with such professionalism and care. So now, no more ado, let's turn our attention to celebrating the extraordinary work of this year's finalists. Back to you, Louise.
Thanks, Sally. So it is my pleasure to showcase the first set of finalists. So over the next few minutes, we'll hear from 4 of our 8 finalists whose innovations are tackling the challenge of antibiotic access head-on with smart, scalable and community-driven solutions. We'll begin with ABX Guard, followed by Comwatch, PADS and FATI. Let's dive in and hear more about these remarkable innovations.
Namaste from Team India. We are Team ABX Guard, advancing an AI-powered digital platform to safeguard access to quality-assured antibiotics for India and the world. Today, 1 in 10 medical products globally are substandard or falsified, and 68% of Indians still lack reliable access to essential antibiotics. The consequences are dangerous and growing. ABX Guard is our solution. It digitizes antibiotic supply chain, enables real-time stock of visibility, flags counterfeit medicine, and connects the entire ecosystem. Our platform integrates 4 core pillars: real-time public health supply chain data, community-led surveillance, private pharmacy reporting module, and an AI-driven dashboard for rapid and actionable insight. What makes ABX Guard different? It's co-designed with the communities and deep-rooted into the public health system. What makes ABX Guard even stronger is the powerful partnership behind it. ABX Guard is supported by trusted partners like Path India, CDAC Noida, Indev Consultancy, and a grassroots level NGO. Because the future of antibiotic is not just about access, it's about assurance. And with support from the Trinity Challenge, let's make ABX Guard that assurance. Thanks from the team ABX Guard.
Comwatch is taking the fight against fake antibiotics to where it matters the most, the community. Nearly 1 in 6 antibiotics in Nigeria is substandard or falsified, fueling deadly drug resistance. The root cause of fragmented paper-based zero real-time tracking system. That's why we built Comwatch, a low-cost community-driven surveillance and stock management tool that transforms everyday people and local vendors into first line of defense. With a simple app, social media chatbots, and text message, anyone, whether literate or not, can verify antibiotics in seconds. AI checks it against the national records and instantly flags counterfeit. Vendors use the same app to manage stock, track expiries, and prevent shortages even offline. Every scan feeds a real-time dashboard. We predict stock out, we detect hotspots, and we help regulators act before lives are lost. In 2 years, we will protect millions and build Nigeria's first antibiotics community database. With the Trinity Challenge, access to safe, effective antibiotics is possible.
Antibiotic-resistant pathogens could kill hundreds of millions of people by the year 2050. pads can help to prevent this catastrophe by finding the bad quality products that breed superbugs. The problem is that you can't tell whether an antibiotic is bad quality just by looking at it. The pad is a paper analytical device that turns the chemicals inside a pill into colors that anyone can see. A phone app measures the colors and reports whether the antibiotic has the right amount of the right ingredients. If a product is suspicious, the app advises healthcare workers how to protect their patients and engage labs and regulators in their country. Trinity funds will ensure that bad quality antibiotic products can't hide anymore in a country's markets. This will protect patients now and in the future.
In places like the Congo DRC, patients often walk through hours visiting multiple pharmacies just to find a simple antibiotic. Or worse, they end up with a poor quality medicine. That's why we built FATI, a mobile platform that gives patients real-time access to pharmacy inventory and lets them report low-quality medicines, generating community-level early warning signals. Pharmacies, in turn, use our mobile ERP to track stock, receive stockout alerts, and get AI-powered demand predictions, helping prevent critical shortages. In 4 years, we've helped many patients cut antibiotic search trips by 60% and flagged 15,000 risky treatments. With the support of the Trinity Challenge, we are ready to scale FATI's real-time health intelligence, protecting millions and strengthening frontline supply chains before the next public health crisis hits.
Wow, what a fantastic start from those first 4 teams. It's always wonderful to see such bold, practical innovation in action. And I do know the judges and all of us have been deeply impressed. So now let me take the pleasure of introducing our second group of finalists. And our final group in this segment, we're going to hear from Pravar, RxBot, Sproxil Defender, and SureDose. Over to the little pitches now. Thank you.
In India, a country which manufactures medicines for the world, millions still walk into a public health clinic only to be told that the antibiotic they need is unavailable. The doctor prescribes an alternative, unaware of its efficiency due to local resistance. The store manager has no visibility into stock or supply timelines. Project Pravar is our response, a multi-component tech-enabled solution combining predictive modeling, real-time demand, consumption, and antibiogram data to guide procurement. Digital tracking, barcoding, and patient-level dispensing enable dynamic stock redistribution. A voucher system ensures interim access via private pharmacies. With Trinity Challenge support, William J. Clinton Foundation and partners, the state government, PharmaRac, IBHAR, WHO Country Office for India, aim to build a self-sustaining framework benefiting all stakeholders with improved access, stewardship, and AMR response, enabling potential impact of averting estimated 400,000 annual cases due to AMR in the state. Thank you.
Hi, I'm excited to share with you a simple, cost-effective solution that allows us to enhance access to safe and quality antibiotics in Nigeria. In Nigeria, antimicrobial resistance accounts for over 65,000 deaths, and over 20% of deaths among children under 5 are also attributable to antimicrobial resistance. A lot of this is due to substandard and falsified antibiotics. Therefore, our solution proposes a WhatsApp-based platform that links healthcare workers, mothers, and pharmacists. They would be able to verify drugs, report their interaction with the drugs, and also communicate this to the medicine regulators in the country, thereby enhancing community-based surveillance. We call on the Trinity Challenge to partner with us to scale up RxBot across the country and to empower healthcare workers to better track fake and substandard drugs. Work with us. Let's save lives. Thank you.
Hi, my name is Ashifi, founder and CEO of Sproxil. I started Sproxel 15 years ago in response to a public health emergency where a local manufacturer made a batch of tainted teething syrup that left 84 infants dead. In response to that, we created a system specifically designed for LMICs where an item unique code is placed on the packaging that a consumer would be able to use to verify by sending in the code to us for free on their cell phone and getting an instant response. They can also call our call center and speak in local language to verify. The Trinity Challenge Award will help us expand the success we've enjoyed in antimalarials to antibiotics, where over a 9-year period, we've been able to reduce the chance of buying a substandard or falsified antimalarial from 1 in 5 to 1 in 77 in Nigeria. We'll expand to animal health, integrate with the antimicrobial resistance and surveillance system that a regulator and WHO use, and set ourselves up for expansion into East Africa. Join us as we tackle this really important problem. Thanks.
Hello from Kenya. This is Daniel Gucho presenting on Shodo solution that is aimed to enhance the fight against substandard and falsified medicines targeting Kenya and Cameroon. We aim to sample from high-risk areas, test and report using a digital infrastructure that will bring about realization of real-time visualization through creation of dashboards and allowing community reporting and surveillance through SMS and WhatsApp platforms. This will in turn boost the national medicine surveillance through increased community participation, reduce on circulation of substandard and falsified medications, and also in future, we intend to scale up this project to our entire mini lab network that's currently spread across 19 partners in 13 countries in Africa. Our partners for this project are DFARM, Field Intelligence, CAFSA, and Cameroon Baptist Convention. Thank you.
Wow, thank you to all 8 of our incredible teams. I'm sure you will agree there has been an enormous amount of potential on display today. Before we reveal our challenge winners, I would like to pause and take stock with the help of our expert panel and explore the context in which these innovations are so greatly needed. So I'm pleased to be joined once again by our host, Dame Sally Davies. And I would also like to welcome Steve Davis, a trustee of the Trinity Challenge and a leading figure in global health and development. Steve is currently serving as Senior Advisor and Interim Director of Philanthropic Partnerships at the Gates Foundation and is co-chair of the G7 III Initiative for Impact Investing in Global Health. Welcome, Steve. And also to Professor Helen Nguyen, the team leader of Farm to Vet, grand prize winner of last year's Trinity Challenge on antimicrobial resistance, and the Ivan Rachev Professor of Environmental Engineering at the University of Illinois Urbana-Champaign. Welcome, Helen. Thank you all for being part of this discussion. I'm going to direct my first question to Steve. So Steve, what role does an organisation like the Trinity Challenge have in the current global health landscape?
Well, thank you. And first, let me add my, enthusiastic response to these 8 nominees. It's really fun and exciting to see the kind of innovation and really creative thinking. And I think that gets to why Trinity Challenge is so important. The world of global health is in a very complicated place. A lot of funding is moving in different directions. A lot of new issues are arising, and there's a lot of fragmentation. And yet, needs remain high, and the need for innovation, creativity that combines both new use of technology, more locally led solutions, and really innovation from people working the problem on the ground. That's really what we're going to need more and more of. And I think the Trinity Challenge really plays an important role in stimulating that.
Thanks, Steve. And just to follow on from that, if I may, how do you think entrepreneurial thinking can help drive progress when these funding streams and resources are so limited at the moment?
Well, look, I mean, we're going to need all the help we can get from, domestic resources in countries around the world and their own governments, playing, increasingly larger roles to, rethinking the role of philanthropy and over the development assistance programs. But all that is going to be spurred on by, local innovation. And I think if there's ever been a moment that entrepreneurs who think about new opportunities, new ways to crack a problem, do it at lower cost or higher effectiveness, get things more in the hands of users or closer to users, and patients, that's where the breakthroughs will come. And then, we'll work. The thing about Trinity Challenge too is we can then help profile, identify, encourage, and then of course support a few of them. But as importantly, then help those start on the road to scale, because these also, the winning ideas need to scale, and that's critical as well. But it's going to be more important than ever in the next decade.
Absolutely. Thanks, Steve. I'm going to turn to Sally now and ask about partnerships. So what role do you think cross-sectoral partnerships, such as those between government, tech companies, academia, and NGOs, play in scaling these innovative data and technology solutions, and in particular for AMR?
Thanks, Louise. Well, I'm going to build on what Steve said. In fact, no one can do it all. And my experience, governments are more bureaucratic than innovative. Technology doesn't know what the problems are at the grassroots level and therefore can't solve them on their own. But put them together, technology and the experts at the grassroots, they know the problem, they can find the solutions, and governments can help scale. So with true partnership that has to be based on respect, bingo, whoom bang, we can get there, or at least you, the winners, can, and I believe many of the others can as well.
Thanks, Sally. And another question for you about the level that we've pitched this challenge at. So both this and our previous challenge on AMR focused specifically on community level interventions. Why is this so important in mitigating AMR rather than targeting more formalized settings such as large-scale manufacturing or hospitals?
Well, of course, the simple answer is that we're just rectifying the balance. Most money goes into specialist care and hospitals, but it isn't about that just. It's about treating people with infections effectively. So you need to know the infection. You need to know, is it sensitive to the treatment? And then you need effective medicines. And in hospitals, all of that is part of a quality system, and the manufacturers and government play their roles. But in the communities, in low and middle income countries, there can be what I would call a wild west, and that's where we need affordable interventions. They need to be of quality, and we need innovation to show that they are of quality.
Thanks, Sally. My next question is to Helen. Obviously, Helen, you're sitting in this seat in a very different position than you were this time last year. Your solution, Farm to Vet, won last year's grand prize. And you're building a surveillance platform by putting an app into the hands of subsistence farmers in Vietnam. Could you talk us through how you build trust with that community, and how do you incentivize them to ensure that this new app and the technology is adopted?
Sure. So first, I am very grateful to be here, and I'm so inspired by the new solutions proposed this year. Since the beginning of Farm to Vet, we went to the farmers' homes We listen to their stories about their lives, their livestock productions, who they trust, who they do not trust. We learn about their supporting systems, and we found out that their supporting system include local agriculture extension personnel, local vets, and the suppliers for their farms, like who give them feed, the mother pigs, father pigs, and baby pigs, and things like that. So now we have been working not only with the farmers themselves, but also with their supporting systems. We listened to all of these people and incorporated their feedback into our product. We asked them specifically what they would like us to do, whether they prefer seeing images or listening to voices or typing, and what platform they like to use, what are their most important issues is. We are working on incorporating their successful practices to reduce use of antibiotics while keeping their livestock healthy into our product database.
Brilliant, thank you, Helen. And are there any incentives that you're able to offer to encourage more of this community to take part?
So right now the incentive that we offer is to reduce their cost of buying antibiotics in their productions.
Thank you. And now you're almost a year into your project and working with us at the Trinity Challenge. Could you tell us what your biggest success to date is and what's coming next?
Yes, so our biggest success is we were able to release a functional minimal viable product farm to vet chatbot 1.0 on August 10 for testing. Since the very beginning of the project, we work hard to curate a database and at the same time develop the chatbot. We release a prototype 0.0 in May for internal testing, and then another prototype in July. We have asked our potential user to test and score our product. In July, the chatbot did not yet have a brain, and the user could not give it a score. After a few weeks, we worked really hard, and on August the 10th, we invited 6 potential users, and they gave our product a 2.5/5 score. We aim to meet with our user every month between now and January, and to release another version in early January 2026. We aim to have our product not only having a brain, but a smart brain and a beating heart in January 2026.
Brilliant, wonderful. Thanks, Helen. And we can't wait to see what happens next for Farm to Vet. My next question goes to Steve. So Steve, what has excited you about the innovations being presented by today's finalists and the potential they have in responding to AMR globally?
Well, thank you. I mean, a lot has been said, but one is just to put a finer point on the focus on AMR itself, which I think is, as Sally said, we've made a lot of declarations in the global health community. We know what an extraordinarily significant issue it is and could become. And yet, honestly, there's not been a lot of mobilization of technology or product development, or it hasn't really been central to the innovation community in the global health space as we've been working on so many other things. So the very fact that we are concentrating it on this important issue that is somewhat complicated, the way it works, it involves sort of ensuring quality products. It ensures it's about dosage and usage. It's about access. There's so many different pieces, I think, these products and tools have been really addressing that. I am also always excited as I mentioned earlier, about anything that in the work I do teaching on health and other kind of innovation at Stanford is anything we can do to support people who get closer to tools that are, closer to the community, both in terms of their development, but also their usage. And so many of the things we've seen today, will be used by health workers directly, community, or patients. And I think that's the future of a lot of work we do in global health.
Thanks, Steve. So we're almost at the end of this section, but I have one question that I'd like to ask all of our panel before we finish and move on to the big announcement. So starting with Helen, if I may, what piece of advice would you give the finalists and our winners to maximise the impact of their innovations?
Yeah, so work with your users as much as you can and learn
Thanks,
from
Helen.
them.
Thank you. And now to Sally, what advice would you
That
give?
one. Let me say, back your instinct, go for it. But I can also tell you it's going to be a lot of hard work. Go for it.
Thanks, Sally. And finally to Steve.
Yeah, well, kind of correlating the two is that just tenacity, that we see products that finally really do hit the target and scale up. And it shows that more and more evidence it's people, those that have champions that just don't give up. And if the evidence is there and the customers are happy that they're not giving up, and so just don't give up.
Thank you, Steve. And thank you to all of our panelists. I really enjoyed talking to you today. I'm going to hand over now to Dame Sally again for the much anticipated winners announcement. Thanks.
Great. Thank you, Louise. Thank you, colleagues. And what we've been talking about is how vital innovation, technology, and the community together are all vital in tackling AMR. And now to reveal who's going to put these principles into action as we announce the first of our 2 grand prize winners of the Trinity Challenge on community access to effective antibiotics. And it's my absolute pleasure to share that the first team to receive a prize of £500,000 is Comwatch by J. Paego, Nigeria. A huge congratulations. So I'm delighted to invite Dr. Yemisi Ogundare to accept this award. Hi, Yemisi. Well done. An extraordinary achievement. You must be thrilled. So tell us a little more about your solution and how it tackles the issue of stock control of substandard and falsified antibiotics.
Thank you so much. We are so delighted about this. And oh my goodness, we're so excited. I mean, our solution just gives power back to the community. It's a mobile application that is coupled with an SMS, coupled with a chat box that is linked with a national system that allows community members to be able to contribute to the data that helps for public health decision making, to help us to reduce the issues of antimicrobial resistance and improve, the health of vulnerable community members all over the world. And so it's our delight that we have been honored with this opportunity to do this in Africa, and we're so excited because we know this can be scaled up beyond Nigeria and to other West African countries where we know that infrastructure issues are there, disease burdens are higher, and there are also no community data that links up and helps for great programmatic public health intervention. So we're delighted, we're so excited. Thank you.
We can hear you all, yes. So perhaps you can fill us in a bit. Why is this technical innovation needed in Nigeria to combat AMR?
So in Nigeria, like we know, the data speaks for itself. We have huge gaps in antimicrobial, the impact of antimicrobial resistance, the children dying every day, their families that are losing parents every day because of antimicrobial resistance. And that is fed from the falsified antibiotics, inavailability of antibiotics down to the community areas where the stock issues are eminent and all. And so we're very excited that this would help us to generate data that doesn't exist. So we have few data here and there, but as a country, we do not have data that helps us to plan effectively. And so this is an amazing opportunity that for the first time from ground up, we get community members to be empowered to be able to generate data that we can use to change and impact. And the government can also use this to make changes in country.
Wonderful. So you've integrated the approach to both stock control as well as the substandard and falsified antibiotics. Tell me why that's important.
That is super important because the gaps are interconnected. It starts with a fragmented paper-based system that are used at community level, and it also starts with poor stock management at community level. And so it trickles to the households, trickles to families where the vendors of the communities do not have access to antibiotics that are good or can account for it. The communities then don't get it. And so they're not able to treat on time. The healthcare workers then don't get it. So they're interconnected. And that's why we felt very strongly that approaching both, you know, it would help for access, it would help for surveillance, and it will bring solution to the community.
So tell me why you find the One Health approach important.
Because our animals are important. Our environment is important. So we're not just doing this for just the human health, we're integrating with the agro-vets across the communities, we're integrating with the vet clinics, because if they get it right, if the One Health approach is integrated and we get it right, then we will reduce the burdens of AMR, and both animals and both our environments and humans will have better outcomes. And so the One Health approach is super critical for us on this, and antibiotics feeds the 3-point approaches. Yeah.
So you're aligning the community, the vendors, and the regulators. Why is that so important?
Because over time and in all the solutions, the many solutions we have in country, we realize that the link is disconnected. So sometimes you have a little bit of community data, but the government don't know about it. And so it's not able to, data is not used for adequate decision making. But we were able to link the 3 holds so that the regulators get visibility into the data we're finding, and they can use it as a tool for decision making, as a tool to stop AMR issues and to stop falsified and substandard antibiotics, and then advocate for appropriate supply that gets down to the communities.
So exciting. So last question, where do you hope this solution will be at the end of the 2-year grant term?
We see the solution everywhere in Nigeria. We see the solution scalable to other West African countries. We see the solution scalable to other low middle income countries, because it's easy for community members, it's easy for national government to be able to get visibility into the data. They can use this to make programmatic decisions. So we see this scalable globally, but of course, starting from the most vulnerable, starting from the low middle income countries, from our home country, Nigeria, and then all over the world. So we see this going. We know it's going to be a lot of work, but we already are excited to make this happen. Yeah.
So I look forward to you showing me how it's doing when I'm in Nigeria, I think next June. Let me again congratulate you and the team, everyone involved in developing this great solution. I'm thrilled we're going to be working with you, as you can see, and I look forward to watching the impact of your innovation over the next 2 years. Well done, Yemi.
Thank you.
And now we're going to come to our second joint grand prize winner, and I'm delighted again to reveal that our second grand prize winner is PADS by the University of Notre Dame, deploying across Cameroon, Ethiopia, Kenya, Malawi, and Namibia. A huge congratulations to the entire team. And from PADS, I'd like to invite Professor Maria Lieberman to accept the award.
Well, I'm honored. I'm honored, and I'm really grateful. This is coming at a very a very important time for us because of the changes in the funding situation in the U.S. This couldn't have come at a better time. And
Maria, congratulations. So tell us a little more about PADS and how the award will help identify substandard and falsified oral antibiotics.
Yes, so we have been working for more than 10 years to develop a point of use test card that can be used to identify medicines that don't contain the correct chemicals, or they might contain the correct chemicals, but not the right amount. And so that technology then can interface with the stock control technologies developed by other organizations. And we're really interested in building tools that will let people communicate these test results across borders and to share this information, because that can really increase the impact. If a bad quality product is developed in one country, often people in neighboring countries never hear about it. And so it would be very protective if we could share that information more easily.
Like you, I dream about solutions like this. So give me an example of when a paper analytics device, which some people call the lab on paper, has uncovered a falsified medicine.
So we had community health workers in a rural area of Bangladesh who were testing antibiotics. So they tested a brand of amoxicillin, and the color barcode that's generated by the paper card is characteristic for the active ingredient. When they tested this particular brand, they found that none of those colors were present. And when we got the product into lab and tested it, we discovered it consisted of chalk and starch. And yeah. Yeah, so these products unfortunately are circulating in many markets, and it's very, very difficult to identify them.
And people will die because they need these treatments and they're not getting them, but they're paying for them. So how will the affordability and simplicity of your innovation benefit those people in the communities?
So the paper test cards are very inexpensive to make. And also we've been working with collaborators in Malawi and Ethiopia to do local production of the cards. And so that's one of my goals for this project in the next 2 years. We would like to do more of this technology transfer. And also we're working on transferring the technology that's used for the cell phone reader that could also be translated into local hands.
So you want to go into multiple countries and you want to enhance the technology. How are you going to start doing that?
So the first step is going to be in each country, we are going to set up a technical working group, and that will engage stakeholders. We need to work with regulatory officials in each country. We would love to be working with pharmaceutical manufacturers and distributors because they're a really important part of this issue. And sometimes when we find a bad quality product, it is because of something where there's maybe a technical issue that would enable a manufacturer or distributor to improve the quality of the products that are reaching the market. And so we want to be open to that.
So it's not all criminal. Some of this is about helping people do a better job. What a great idea. So you've talked about some partnerships, but tell us what you think are the important partnerships to make this really work.
I think we are really wanting to engage with WHO in just in terms of, again, of information sharing with regulators in each country, and then also with the clinical caregivers who are the people who are, I hope, are going to be able to use these cards at, you know, small clinics, at medicine shops, at veterinary supply stores. We will be working to bring those people in and work out the logistics of how to get cards to them, how to give them the video training so that they can use the pad reader app, and then enroll them in the Verify system, which is going to collect all the sample metadata for the products.
Oh, I'm so looking forward to seeing the results. So tell me, finally, what's your long-term ambition for PADS?
So there is currently no global system for doing post-market surveillance of antibiotics, and I want to build that system. That's where we're going.
Well, we definitely agree we need systems. Whether there's one or two, you can always join them up, but we need systems. So thank you very much. And let me reiterate on behalf of all of us how delighted we are to be presenting you with our second grand prize. Your solution really answered our call to enhance community-level access to effective antibiotics. And together, you're helping us turn ambition into action in this global fight against AMR. Thank you, and congratulations, Maria, on your award to you and the team.
Thank you. And I want to thank the team for their support in this whole project.
Thank you so much. Right. So, in closing, let me once again extend my warmest congratulations to both of our grand prize winners. Your vision, commitment, and hard work are, as we can see, truly inspiring. And I hope everyone joining us today feels as energized as I do by the potential of your solutions. But let me also say that the judges found it really difficult to choose the two winners. Everyone here, the other 6 were shortlisted, were winners too. And we hope that you will get support so that you can develop your solutions as well. I also, in ending, want to reiterate my sincere thanks to all of our supporters, particularly the Institute of Philanthropy of the Hong Kong Jockey Club Charities Trust, Novo Nordisk Foundation and Wellcome Trust, because their commitment to this challenge and our broader mission of the Trinity Challenge is vital and deeply appreciated. To those watching, let me encourage you to stay connected. You can follow the journey of our winners and the Trinity Challenge more broadly by signing up to our newsletter via the QR code now on your screen. And I also want to take a moment to recognise everyone who applied but didn't receive funding. I know it's hard work, but maybe you'll find that you can get money from somewhere else. Maybe it'll start you on a journey to solve AMR in your locality, your country. We really need you all working on the ground. I hope you develop new ideas, partnerships, and pathways that can grow and develop, because we all share the same mission. We want to mitigate the threat of AMR. And I believe there's space for each of your innovations in that fight. Where we can, and to support you, we will. And I call on everyone here on the call to do the same. Let me be clear. This is an antibiotic emergency. And in any emergency, both innovation and collaboration are critical. Whether you or someone in your network can offer funding, technical expertise, or operational support, I urge you to contact us, whether it's for the winners or it's for the other wonderful solutions. If you're willing to help, we'll gladly facilitate these connections, because the projects are brimming with potential. And in the face of AMR, after all, a threat that knows no borders, their success will not only benefit individual communities, they're going to benefit all of us, and as I say, our grandchildren. So, please don't let this be the end of the conversation. Let us continue together to champion these innovators and ensure that their impact and our other finalists are realised far and wide. Well done to everyone for competing. Well done to our winners. And thank you everyone for joining us today. Thank you and goodbye.